Yeah. Ladies and gentlemen, once again, my name is Peter Bukanakame Saimo. I'm the Bachelor of Physiotherapy, third year. So for today's topic, we are going to talk about what we are doing about surgery, and the topic we call principle of open heart surgery. So in open heart surgery, we are going to talk on the content, we are going to talk on the types, we are going to talk on introduction, the definitions, and secondly, we are going to talk about the types of open heart surgery and the two related indication. Then lastly, I will talk on two principles whereby it's supposed to be the main topic. I'm going to talk on two and investigation of open heart surgery. Then thirdly, then I go for diagnosis, differential diagnosis. So let me start with the principle of open heart surgery. Let me start with the definition of open heart surgery. So the open heart surgery is a whereby the surgery open the chest and which the chest is the surgery is performed to the heart muscles, artery valves, and then secondly the surgery is a blood vessels, the vessel which connect like arteries. Okay, then the types of this one of open heart surgery. One we have a off pump surgery. In off pump surgery, this can be done by this is the form of pump surgery in which it can be done by any mechanical devices in which the heart can be supposed to be performed. And secondly, the two one we have beating heart. So this form of energy does not need like the use of any devices, but it can be actively performed can be done actively by the surgeon, in which the hearts can be beaten to the movement of the blood vessel from a different part. This can be done. Maybe sometimes you find this type of surgery, some open heart surgery. Sometimes you find out, or maybe the person has let me say, the obstruction of the blood vessel within the heart, maybe the aortic valve, in the way where this can be done. And then we have robotic type of surgery. So in the robotic type of surgery, this type of surgery can be performed by, because there are two in the two, this can be done by computerized. So either by the camera, let's say we have what is called angiography. This can be maybe by biopsy. In the biopsy, this can be done whereby the camera must be inserted by the devices to make sure to show either the obstruction of blood vessel obstructions or coagulations in the blood vessel. And this can be performed by the two. Then from here, we are done with the types of because in the types of open heart surgery, we have pump, and then beating heart surgery, and then robotic heart surgery. Then thirdly, I'm going to talk on indications. The indication of the open heart surgery. So in indication of the open heart surgery, there are distinct indication of open heart surgery. We can talk on one is the coronary defects. In coronary defects of open heart surgery, let me say this can be done by whereby the arteries which is like surrounded by which supplies the heart from the different parts, maybe let me say in the left ventricle or side ventricle, because all the hearts, let me say the coronary artery supplies all the society, let me say the size of the heart. But for sure, with coronary defect, this is whereby it fails to supply blood to all these parts, because in this part, the coronary heart artery, whenever like they cause defects, maybe there's an obstruction coronary artery. Secondly, we have a ventricular valve defect. Ventricular valve defect. So in the ventricular valve defect, this defect is one of the most lessened ventricular in when socially the ventricles or the valves of the ventricles got affected to perform themselves to pump blood out and in. Maybe whenever like this there's a defect in this one, the cardiac output in which the blood supply outside to the peripheral part of the body can be decreased. But mostly when the valve, this valve in which is supplying the inner part of the body blood, this can be what? Sometimes can get vascularized. That's why sometimes this type of there's a one type of surgery which can be performed by the devices. The devices like let's say on pump form of the this has been done by this type. And secondly, we have congenital indication. This is sometimes also can be indicate congenital defect arteries. Sometimes with the children, with the young children, so small babies, actually like those who suffer the most heart failure, whatever, it might occur maybe due to the coronary artery defects or due to valve defect. And thirdly, is that pump blood. And then this one, these are the major indications of which can be performed, to which heart surgery can be performed. And thirdly, I'm going to talk on investigation. In investigation, what is happening? Let's say in investigation, what is happening? In investigation, first of all, we need to diagnose. In investigation, first of all, we need to take blood count. And secondly, we have to take creatinine. And secondly, another one, we need to take WBC count. So that either maybe there's abnormality, maybe there's red blood vessels in the, let's say there's the white blood cells are less in the blood, maybe they can be, maybe there's another abnormality. Then the blood count, let's say that like the WBC, no, like the RBCs, red blood count. This you must count like a red blood, let me say red pigment, like let me say hemoglobin in the blood, maybe count either the patients affected with these, maybe different diseases, to know the number of RBCs in the blood. And lastly, we need to check on anemia. If there is any infection disease, the patients maybe might have anemia. This can be these are the investigation. So the assessment, in assessment, we normally take like some other parts. Either the patients have these are the most assessments in which we need to investigate. Firstly, and thirdly, we are going to come to diagnosis. What are diagnosis? In the diagnosis, so like in the first place, after investigation, we need to take a diagnosis. Maybe the patient is having differential disease, and you need to check from the peripheral. Maybe the patient is having atherosclerosis. Maybe there's an infection in the artery before like performing the heart surgery. Thirdly, we need to take a respiratory diagnosis. In the respiratory diagnosis, the differential form of diagnosis which can be performed to either the patient is having like difficulty, maybe asthmatic patients, maybe the patient having emphysema, to check out before performing this one. And this type of business. So these are the 4 my points which I'm supposed to explain, which I was given to you people. And thank you very much for attending. If there is any other query, please you can write in it in the inbox so that I can know your question, so that I can reply you back. Thank you very much. My name is Peter Okana Kamisai, Bachelor of Physiotherapy, Marwari University. Thank you.